Alright, so let's go through the ward round. It can be a bit of a whirlwind. There's lots and lots of information flying all over the place. You kind of don't know who anyone is if you're just starting out. Say if you're the med student who's just rocked up to their first rotation on, I don't know, cardiology, and there's 10 people on the ward round. That's actually not as likely, but say there's a big surgical ward round, you're doing the general surgery ward round, there's a consultant on there for some reason, you've got a fellow, you've got 3 registrars, you've got 2 residents, a couple of interns, and then you're the new med student on the rotation. It can be a bit confusing on who's who. So let's go through everything, how it works, how to set up, and if you're just starting out as a doctor, what you can take away and what you can learn from the ward round and how to get really, really good at it so you have a little bit of sense of control. Let's get into it. Alright, so let's start things off. We've got the ward round here. So I guess if you go back to bare basics for the ward round, you're mainly wanting to check in on your patients, their progress, how they're going. If the things that you've done initially, say when they first came into hospital, you provided them initial treatment, you admitted them, you came up with a plan, has that plan worked? Has that changed? Have they actually not gotten better as you thought they might? And you need to actually pivot or do something slightly differently and order another test or another scan or clarify a few different things. So the ward round is really good at an audit on how your patient is actually going. So that's the main thing of the ward round. What the point is, it's exactly that, to visit patients, assess their progress, plan, and their ongoing care. And then you actually pick up any issues. So by reviewing the patient, either by them actually telling you, by maybe a nursing staff member telling you, or maybe it's something just that you picked up on their numbers from their obs or their fluid balance or some other chart. Maybe their drain output is like super, super high, and you can actually pick up these things. Maybe you look at the medication chart and you're like, well, they shouldn't be on this combination of medications because that's making them hypotensive or whatever. So yeah, addressing any issues at the time when you see them is super important. So that's the point of the ward round. The things that we do on the ward round are pretty simple, I guess. I don't know, like you just have to check on them, how they're going. Say if they've had an operation, you want to check on their obs, you want to check on their numbers, if they've got drains in them, if they've got tubes in them, catheters, you know, what fluid's going in, what fluid's coming out, and is there anything else that's happening? Are they opening their bowels? Are they not? What are their blood sugars doing? So all the measurable things, you want to actually look at that, because if you're not going to look at it, what's the point of measuring it? The nursing staff do a really, really good job of measuring all those things, and they document it either on the computer, on the electronic medical record, or they put it on their paper charts. And yeah, we should actually review that because that's the point. You might do this beforehand, but you might look at the tests, look at the investigations. If you're one of the hospitals that have a computer on wheels and you can just review things outside the patient's room before you go in, then that's super helpful. But sometimes it's not as convenient, or hospitals just don't have those resources, and you have to look at that before. So make sure you get up all the tests and the imaging and the scans, and if you have a printed out list, then write it down on a piece of paper, or if you have images that you need to look at, then, or that your boss needs to look at, make sure you get those up before they arrive so they can have a smooth look at the pictures. That's really good and helpful. And then I guess the other thing is we actually make decisions. So decisions about what medications we're going to start, what medications we're going to stop, what things we're actually going to do, if they're going to be planned for an operation, or if they're planned to go home, or if they're going to have follow-up in a clinic or with a separate specialist, or if we're going to do anything differently for their care. Maybe it's really focused on allied health and discharge planning and transitioning to some other sort of arrangement. Maybe they came from home, but now they've deteriorated and they can't really get back to baseline, so they need a bit of rehabilitation. Or potentially, I mean, maybe the patient doesn't get better and we need to focus more on a palliative care approach. So all these decisions about the essential, railroad at which the patient's following for their own medical condition is super important. And the ward round guides the patient on that journey. So you can actually like, you know, tell them and communicate with them and, explain what's going on. Like that's the important part of it. So the patient doesn't feel like they're just having stuff done to them. They're in control of their journey, their healthcare journey, and we're actually going to do stuff with them, for them, and to try to get the best outcome for them at the end of the day. So, yeah, that's those are some of the main things we do on the round. I guess going back further, who's actually on the round? So remember I gave that example at the start with the med student who's just rocked up to their first rotation. I mean, that was me in my first rotation on orthopedics when I was a second year med student. And it's very overwhelming and intimidating when you go into the handover room where all the doctors are for the morning round, and they're obviously super busy getting everything ready. But you, on the other hand, are just like there, ready to go, but have no idea what questions to ask, what you should be doing at that time, and more importantly, who's who. So you may have the consultants there. Actually, let's go from the bottom. So I guess if you're a medical student, you're there, you rock up, you see everyone, you're just trying to like learn as much as possible and not like disrupt anything. And that's certainly the vibe that I felt when I was a med student on ward rounds. When you get a bit more comfortable, a bit more further into your medical student training, then maybe you have a bit more of involvement. But as a early young med student, you don't really want to do too much. You're a bit intimidated by the whole process. Then you have the residents and interns. They're the first people I think you would probably see when you rock up for the round, because the interns and resis are getting everything ready. They're printing the lists, they're maybe getting handover from the night team, they're looking at all the numbers, they're essentially just trying to make things go as smoothly as possible. Maybe they're preparing the ward round notes because obviously at the end of all this stuff we have to write notes, so maybe they might quickly jot down a few things here and there. So the actual transition from one patient to the next in the round is actually very smooth. So they're all things that you can try to do to make things go a bit faster and smoother on the ward round. So you can get on to more important things like the clinic or the theatre list or other jobs and everything. So yeah, things that take time on the round is just important to optimize. The last persons who probably get there are the registrar plus or minus the consultant. So the registrar is like they're the ones who essentially lead the round. They make all the decisions if the consultant's not there, or they run it by the consultant after. If the consultant's there in the round, amazing. The registrar will probably just present the round, and each patient that comes by, they'll say, this is person X and this is person Y, and they've had this done for them and that done, and this essentially just checks up on how they're going. And depending on if you're on a medical or surgical ward round, it might operate slightly differently. If it's on a medical ward round, I think there's mainly more time for a bit more discussion, a bit more theory, a bit more question asking. Maybe you look at all the scans together. So yeah, it's different paces depending on what unit you're on. So yeah, the consultant's the key decision maker. That's the person who the patient is under their bed card for. They're not always on the round. Sometimes you have a consultant ward round. Sometimes you don't have any consultant ward rounds and it's all remote discussions. Occasionally, consultants, come by and see the patients just at random when they're at the end of their list or when they're in the hospital and they want to check up on the patient face to face to see how they're going. So everyone's going to do it slightly differently as a consultant, but you as the registrar are like the key link between the patient and them. So yeah, that's who the decision making and question asking runs by. So yeah, that's who's who in the ward round. And I guess as a junior doctor, your main things are reviewing numbers, making sure the list is right, checking what happened overnight for the patient. So I mean, like a big thing like you don't really think about as a med student is, hospitals operate 24/7 and patients are there 24/7. So if a patient's come in, then something's happened overnight, the night team will review them and then they'll make a plan or whatever. And then, they'll communicate that to the day team. And that handover is super important. So as the day team rocks up, one of the main things is to actually receive handover from the night team and actually link between what happened after hours the day before to what happened overnight, and then communicate that to the registrar, because the registrar doesn't really get handover from the night residents unless they specifically come and communicate it to them, or the overnight registrar, if they are there, wants to tell that morning reg something specific. Mainly what happens is that the residents communicate that handover to the day residents, and then that gets relayed to the registrars. So that's super important, and yeah, it shouldn't be missed. Otherwise, because you don't want any surprises on the round. Maybe the patient has had chest pain or shortness of breath or a met call overnight, and you're just finding about that on the round halfway into the conversation. Yeah, that conversation should have already happened a few minutes beforehand, before we actually started the round, and communicated to the registrar. So yeah, that's super important. I guess other things you can do is just check the bloods, check the imaging, check the notes, read all the notes as well. Like, if you're making an update for a patient about how they're going to go home, you want to make sure to see if they're waiting on clearance by the physiotherapist or, social worker. Well, if the social worker and physiotherapist, came by at 2 p.m. yesterday, then, and no one knows about what they said or what happened, then maybe we should actually read the notes from that person and then communicate that to the rest of the team, so that on the round we can actually make a decision about what happens. We're not constantly chasing things. So as long as, people write notes for a reason in the hospital, and everyone's notes are important to some degree, and they have different roles, of course, but if someone writes a note about a patient, it's actually not a bad idea to read that note. And whilst you don't have to read absolutely everything that goes on, because there's a lot of documentation in the hospital for rate limiting steps for a patient's care and management, that is really, really important. So yeah, that's how I would prepare as a junior doctor, an intern resident. I guess the other thing going on from that is if you have to present a patient. So say you're the resident and you're wanting to level up, or you're the registrar and you're presenting on a consultant ward round, you go by each patient, and you have to actually say, well, this is whoever the name is of the patient and what their condition is and how they're going, essentially. So you really want to be on top of these patients, and you want to treat them like your own if they're not already viewed like that in your mind, so that the consultant is listening and understanding, and they're really taking in that you have a clear understanding of what is going on with this patient and how they're going and what their actual story is and what their name is, and them, you've actually asked them all these questions. So that's super important, and it might be brief, but you can just synthesize it into actually like everyday language. And so I've just written up something here just saying, like, say, imagine you're a registrar and you're rounding on your surgical patients, and the consultants there who did the operation with you last night, and you want to tell them about them. You just say, well, this is Tammy. She's a 41-year-old lady. She's day one post-laparoscopic cholecystectomy. She was kept in post-operatively for IV antibiotics and monitoring, and I think if she's been well overnight and is still well this morning, then we can send her home, stop the antibiotics, and see her in the clinic in a few weeks. And that's just a really quick, explanation about what's happening, what's going on, and what's the plan going forward. And you might just say, before you walk in, you say, this is Tammy. She's the 41-year-old lady who had the lap chole last night. I've heard she's been well. We'll just see how she's going. And it can be something as simple as that. So nothing like over the top, but it all depends on the situation and context. So if someone wants a bit more history, then you can go into their past medical history, their regular medications, anything else that's been going on. And this is just a simple post-op surgical patient who you're rounding on. The story might be completely different, as well as the presentation, for someone who's been in there quite a long time. So you can use that. If you're a junior doctor and you're wanting to get the most out of the ward round, listen, really listen. Like, the conversation that the doctor, like whether it be the registrar or the consultant who's having to the patient, can actually it can actually be like the plan can actually be within that conversation. So if you're not listening and taking down notes, then you may actually miss a few things here and there. You need to actually prioritize tasks at the end of it. So after all these after all these patients are seen, you actually need to make sure, what tasks that need to done. After you've seen all these patients, you need to actually figure out what jobs need to be done sooner rather than later. And I mean, when I was on medical rotations, you would have like a couple of junior doctors, it might be an intern or two interns, and one of them might stay on the round with the reg, and the other might actually peel off and start doing jobs for the patients that are already been rounded on. So that's one aspect of it. The other thing, you can just round and then divvy up the jobs at the end of it and actually say, well, I'll do all the referrals, I'll do all the discharge summaries, I'll do all the scripts or something like that. So that's just one way of doing all that. And then I guess clarifying, that's super important, because if you're a junior doctor and you're not an expert as much as the registrar in a certain field, and the reg says something and you're like, what did they even say? Is that even, English, or like whatever language they're speaking about? Like if you don't understand what's going on, you need to clarify, because that lack of clarification or potentially a different plan that you decide to happen is not the best for the patient. So if they want a particular medication rather than another medication, or if they want something specifically done this way and you do it slightly differently, it can actually just change like the management of the patient. So just clarify, because you may actually delay things, or something else could happen. So clarify early on the round, ideally, when it's on that patient. So it may not be the best time sometimes to stop the ward round and abruptly clarify things, but pick your moment, and then you can actually just clarify the plan, because otherwise you don't want things to be missed or misinterpreted. And then you can, yeah, as I said before, stay organized. If you divvy up the jobs, make sure you paper around after to ensure which jobs are done and which jobs are not done. And that's just all the closed loop communication. So I think the last thing is cheat codes, and cheat codes are super important to help the round be optimized as best you can. So things you can do for equipment, you can have batteries for your computer on wheels, so that if you're running low or it's a long round, you can actually just top them up really, really quick. And if you have like a long ward round and you want to be prepared for it, so some snacks, some water, you want to keep on top of things and actually be your best at the start of the round as well as at the end of the round, even though that's quite optimistic. You want to have spare pens, you want to have lube, you want to have other common supplies that on your rotation that you frequently do. Maybe it's like a different dressing, or you want a pair of scissors or something like that. Like you want to actually like have stuff available, so you don't need to go searching for it on that particular ward. Maybe you want to remove a few catheters, or you want to check a few dressings and change it. You just want to have supplies on you, so that when you go to the patient, you don't have to go to a new ward, find the equipment supply room, ask permission to get all these stuff, and you're constantly just like going around to different places, and it delays management of these patients. So if you can optimize that by just gathering a few supplies beforehand, that's really easy. One thing is like having a consent form. So if you're deciding on consenting someone for an operation, then having a few consent forms in your folder in your bag is just like easy, so you don't have to like look for the consent forms on that particular ward. That saves so much time. The next thing is to ensure that the bed numbers and the list of the patients is accurate. Nothing worse than going to a patient's bed and it being a completely different patient because they've moved the night before and no one's managed to update the list, or for some reason it's not correct, and or something. So if the patients aren't added correctly, if they're a consult and they're not on the list, then you need to go and find them and see them, and it just adds up with time. So making sure that list is accurate, so that once you're on the round, you can just see everyone that you need to see and then finish. The other things are paper rounding and updating the nurse in charge after. And both are quite important, to be honest. So paper rounding is essentially going through the jobs on what was discussed on the ward round themselves. So if patient X needs to be discharged, then you need to do job A, B, and C to get them out of the hospital, and then they can be signed off. Making sure all the jobs are written down is really good. So then you can actually have a checklist of what you need to do. And then people, may print out a little checklist and do it and tick off one by one. Or, everyone has their own different system. I would just scribble on a bit of messy paper and, sort of make it work. But yeah, I think just as long as you have a closed loop of communication, that's the main thing. The other thing that I think is super important, I don't know how many people do it, but you definitely should do it, is talk to the nurse in charge after the round. So after the reg goes off and is buying coffee, or they're moving to, ward 2 and you're on ward 1, if you're finishing on ward 1, you just say the other junior doctor, go off with the reg, I'll be there in 2 secs, I'll just update the nurse while I'm here, so they are not waiting on a plan for a few hours or whatever, or however long it takes you to finish the ward round. So that's super important to do, that a lot of people miss. And if you don't update the nurse in charge, things don't actually happen until quite late. So it actually can be time, invested, which is actually going to be quicker and better for the patient. So then you're not discovering that things haven't taken place a few hours into the morning when it could have happened already if you actually spoke to someone about the plan. So yeah, past experience, that's what I've learned. But that's essentially it. So that's the ward round, a very simple guide. Hopefully that just goes through a few basic things that might clarify a few misconceptions or misunderstandings about how everything takes place, who's who, and how to actually make it run as smooth as you can, because a ward round is a really important part of a junior doctor's job, and it can turn into a bit of a chaos, if you don't have any idea what's going on, or you're not prepared and you have bits and pieces that pop up like a met call or a code blue, or you need to do some consent for some patient who, hasn't had their consent done for their operation, or maybe there's a bit of equipment that you should have got beforehand but you can't find it on this ward and you need to go back to the other ward. So all these things are based on experience and conversations with my colleagues. So this is all synthesized into a little cheat code for you. So yeah, hopefully that helps, and you can actually get better at the ward rounds, because they are, they can be very good learning opportunities, but it can be a bit chaotic and a bit of a frenzy if nothing's ready. So yeah, good luck with your ward rounds, medical ward rounds, surgical ward rounds, ICU ward rounds, whatever ward rounds you're doing. Good luck with it, and we'll speak soon. All right, bye.